Welcome to this educational program. This module provides a general introduction to a bladder condition called overactive bladder. This information is independently produced, and all content may not necessarily reflect the experience of your healthcare provider or the specifics of your situation. This program is strictly informational in nature, and no attempt is made to provide opinion or recommendation. Please feel free to view this presentation as many times as necessary. You may also use the player on your left to repeat slides or to skip through them in any order you wish. The term overactive bladder, or OAB, describes a group of bothersome bladder symptoms, which include frequent urination, or peeing, nighttime urination, and urgency to urinate. Leakage episodes or accidents, called incontinence, related to poor control of bladder urgency may also occur. This is called urinary urge incontinence. If you suffer from OAB, you are certainly not alone. It is estimated that 12 to 16% of the adult population in North America and Europe suffer from OAB. In the United States, this translates to up to 33 million people. The likelihood of experiencing OAB increases with age. OAB affects both men and women. To understand OAB further, let us review some relevant anatomy of the bladder. This figure shows that the bladder is composed of a strong muscle and an inner lining of special cells. When we urinate, urine passes through the urethra or urine passage. The urethra is surrounded by a valve muscle or urethral sphincter, which helps to hold urine in the bladder when it is being stored. There are many possible causes of overactive bladder. Most people have what is referred to as primary OAB. This means that for some unknown reason, the bladder undergoes changes which cause it to escape the normal control that we have over it. The bladder muscle spasms or contracts, causing a sudden sense of urgency and frequent urination. If the contraction cannot be suppressed in time, leakage or incontinence results. Researchers are continuing to try to understand what causes these changes. In some cases, OAB may develop as a result of some other condition affecting the bladder muscle, the bladder lining, the nervous system, or the pelvis. These are called secondary cases. Many conditions may cause overactive bladder or be associated with it. Among others, these include bladder infections, thinning of the vagina from lack of estrogen, also called urogenital atrophy or atrophic vaginitis, and pelvic prolapse or stress incontinence, both caused by weakening of the pelvic floor. Overactive bladder is sometimes confused with a painful condition called interstitial cystitis or painful bladder syndrome. In men, an enlarged prostate may result in OAB symptoms. Bladder cancer and neurologic processes can also result in OAB. Whenever one of these secondary causes of OAB is found, treatment must first be aimed at the underlying condition. Most people with overactive bladder do not have any of these conditions. However, it is important that they be ruled out. It is important to emphasize that OAB is not a normal expected part of aging, nor is it a disease. It also comes in many forms and is not the same for everyone. Most importantly, please understand that many good treatments for OAB and incontinence exist, and in almost all cases, improvement and/or cure can be expected. The fact that you are viewing this program indicates that you are well on your way to achieving this goal. So what are the treatment options available for overactive bladder? We can divide these treatments into three broad categories: conservative measures, including behavioral therapy and physical therapy, medications, and surgery. Numerous behavioral modifications can be made which have a significant positive effect on the degree and amount of bother of one's bladder symptoms. We will examine each of these in turn. While some are more specific to overactive bladder, and others to another bladder condition called stress incontinence, they are all worth reviewing here, and all can help to improve your bladder health. Physical therapy, also called pelvic floor muscle training, can also be helpful, and this is discussed in detail in its own module. Behavioral and physical therapy are most successful when done under the guidance of a dedicated physiotherapist or nurse. It is now well accepted that behavioral therapy centers on patient education, which is precisely why you are viewing this presentation right now. Education leads to understanding of normal bladder function and can improve your ability to self-regulate those functions. Without proper education, other behavioral modifications and physical therapy will likely fall short of their potential. There are several simple measures that can be taken to make a big impact on OAB symptoms. These include fluid and dietary modifications, smoking cessation, weight loss, bowel regulation, and exercise. As a general rule, fluid restriction is not advisable as a means of dealing with OAB and incontinence. Limiting fluids will make the urine more concentrated, which can cause bladder irritation and actually worsen urinary urgency. It has also been shown to increase the risk of bladder infections. It is best to try to cycle a larger volume of more dilute urine through the bladder. The recommendation is to take in at least 6 to 8 cups of fluid daily, mostly water, to keep well hydrated. Selective fluid restriction is appropriate in certain situations as indicated by your physician. For example, someone who is taking in excessive fluids should be encouraged to cut back, and someone who suffers mostly from nighttime urination might be advised to cut back on fluids in the evening. Some patients are mostly bothered by frequent nighttime urination and do not have typical full symptoms of overactive bladder. If this is the case, consider these measures. Try reducing evening fluids, completely reducing fluid intake after 7 p.m. It is important, of course, to still keep your fluid intake up during the rest of the day. Be sure to empty your bladder completely before going to bed. Finally, when swelling of the ankles or feet occurs during the day, nighttime urination may result. This happens because when you lie down at night, the fluid is no longer held down in your extremities by gravity and is allowed to get back into the circulation. The body then has to clear out all this excess fluid and starts making more urine. To help manage this problem, if it is comfortable, try spending some time during the day with your head down and feet up on pillows above the level of your heart. This will help to get rid of more fluid in the daytime when it is more convenient for you. Beyond this, you should see your physician, as medications or adjustments to your medications may be required. Certain compounds may trigger nerves in the lining of the bladder, worsening OAB symptoms. These are known as bladder irritants. Caffeine is by far the biggest culprit, and it has been shown that reducing caffeine can improve the symptoms of OAB. This may be true for other foods, however, it varies among individuals. Suspected bladder irritants include sweeteners, such as aspartame, spicy foods, acidic foods, and tomato-based foods. Eliminating these items one at a time from your diet is the only way to know how much they may be contributing. Finally, alcohol most definitely can worsen OAB symptoms, as it directly increases urine production. If you have not already heard of enough reasons to stop smoking, you may be surprised to hear that smoking has quite harmful effects on the bladder. Smokers are 2.5 times more likely to experience urinary incontinence than non-smokers, and all types of incontinence are increased. This occurs for many reasons. Products of cigarette smoke may directly cause overactive bladder, and they are certainly irritating to nerve cells in the lining of the bladder. Furthermore, smoking weakens the pelvic floor both directly by reducing blood flow there and indirectly by causing chronic coughing, which stretches and weakens these supports. Finally, and most importantly, smoking is the single most important risk factor for bladder cancer. Obesity increases the risk of stress incontinence mostly, but also mixed incontinence including overactive bladder and bladder infections. Increased downward pressure on the bladder likely leads to more stress incontinence and OAB symptoms, while poor hygiene in obese women may result in bladder infections. Poor bowel habits are often overlooked as a cause of bladder problems and incontinence. Chronic constipation and straining to pass stools weakens the pelvic floor, causing stress incontinence and prolapse of the vagina, both of which may be associated with overactive bladder. Regardless of what bladder problem you may experience, it is recommended that steps be taken to improve your bowel habits. These include increasing fluid intake, increasing fiber intake, and regulating one's bowel habits. Your family physician or a dedicated nurse or therapist can assist you with such a program. Certain hygienic and sexual practices for women may help to reduce bladder infections. While they do not directly impact on overactive bladder, they are worth discussing, as bladder infections can certainly aggravate OAB symptoms. After urinating, wiping from front to back avoids bringing organisms, or germs, from around the anus to the opening of the urinary tract. It is common teaching that women should empty their bladder before and after intercourse, and while it is not clear how successful this is in preventing bladder infections, it remains widely recommended. Water-based lubricants may also help protect against infection. Finally, avoiding the use of diaphragms, cervical caps, some vaginal douches, and spermicides, which are found in some condoms, is a wise idea. Other measures which can lead to improved bladder health include maintaining a regular exercise program, getting control over a chronic cough, and keeping regular visits to your doctor. Regular exercise improves one's overall health and sense of well-being. It also promotes proper hydration, which can improve bladder symptoms. It promotes blood flow to the bladder and pelvic floor, and it improves overall muscle strength and endurance. Chronic cough, such as with smoking, asthma, or acid reflux, also causes chronically increased pressure in the pelvis, which both weakens the pelvic floor and leads to more leakage episodes. These conditions need to be addressed with the help of your physician, and many successful treatments exist. Finally, regular visits to your physician can help to monitor these and other important related health issues, such as diabetes, neurological conditions, menopause, and mobility problems. There are many different toileting programs, some of which are independent, while others are assisted by a caregiver. The two most common toileting programs are scheduled voiding and bladder training. Scheduled voiding simply involves urinating at regular set intervals by the clock to prevent the bladder from getting too full and reducing leakage episodes. The goal of bladder training or retraining is to gain a greater control over urgency, to accept larger amounts of urine in the bladder, and to reduce urge-related accidents. To be successful, this therapy requires significant motivation and is best done with the assistance of a dedicated therapist and occasional voiding diaries to provide feedback. Initially, you are asked to adopt a regular schedule of urination. For example, set a goal of only urinating every hour or two by the clock. When an urge to urinate does come on, try to suppress this using the techniques on the next slide. Gradually, you will be able to lengthen the interval between urinations. Try these techniques to suppress urinary urges. Stop what you are doing and stay still. Squeeze the pelvic floor 5 or 6 times quickly, 2 to 3 seconds each contraction. Keep the rest of your body relaxed. Focus on something else, such as counting backwards. Finally, as the urge passes, try to walk to the bathroom at a normal, relaxed pace. Pelvic floor muscle training works to strengthen the muscles of the pelvic floor, which support the structures in the pelvis, such as the bladder. There are several reasons to do this training. One can better learn to contract the muscles around the urethra and the neck of the bladder, which strengthens the support of these structures. In doing so, a person can gain the ability to unconsciously contract these muscles, for example, when a sudden urge to urinate comes on, or prior to a sudden unexpected sneeze. This in turn can benefit patients with OAB, as well as those with another type of urine leakage called stress incontinence. In addition, the increased awareness of these muscles may lead to increased pleasure during sexual activity. Pelvic floor muscle training is discussed in detail in its own separate module. Biofeedback is a type of therapy usually performed by a dedicated pelvic physiotherapist or nurse. The goal of biofeedback is to enhance the effectiveness of pelvic muscle training. Biofeedback uses sensory signals to give feedback as to the effectiveness of an attempted contraction or relaxation of muscles. These signals may be auditory, visual, verbal, or tactile. Biofeedback also allows one to quantify muscle strength, which gives important information about where you are starting from and how your therapy is progressing. Typical methods of biofeedback include placing fingers in the vagina or rectum to gauge pressure, using a probe in the vagina or rectum which is connected to a meter or electric signaling device called an EMG, and skin patches connected to a similar signaling device. If required, your doctor can help you find resources where biofeedback is available. Pelvic floor electrical stimulation is available at some centers. It can be helpful to assist in pelvic floor muscle exercises, but does not replace them. This treatment involves the application of low-grade electrical current to the pelvic muscles. This serves to stimulate muscle activity and help you identify the muscles to squeeze, to inhibit bladder contractions and thereby reduce symptoms of OAB, and to improve pelvic muscle relaxation. Pelvic floor electrical stimulation is usually taught by a dedicated clinician, such as a doctor, nurse practitioner, or physiotherapist. It is then continued at home. As a final word about conservative treatments for overactive bladder, it is important to remember that just as we need to learn to actively contract our pelvic muscles to help combat overactive bladder symptoms and incontinence, we must also focus on relaxing those same muscles while urinating. Poor relaxation of pelvic floor during urination can worsen OAB symptoms and can lead to retention of urine and bladder infections. Pelvic floor relaxation should be the first step to start the urine flow. This relaxation must be continued through the entire urine flow. To do this, take plenty of time, relax, and breathe slowly while urinating, and try not to strain if it can be avoided. If your stream is intermittent, meaning that it starts and stops in midstream, then this might mean that you are not keeping this relaxation through the entire urine flow, or that you are straining to urinate. There are many drugs now available which are very effective in treating the symptoms of OAB. The majority of these drugs work by relaxing the bladder muscle, and ideally should be combined with ongoing efforts at the conservative measures we have just discussed. In the past couple years, many new drugs have come onto the market to treat this condition. While all of these can cause side effects such as dry mouth, dry eyes, constipation, and confusion, among others, the newer medications seem to be better tolerated than previous ones. Your doctor can help to find the best medication for your situation. A separate module is available through your doctor's office that discusses these medications in more detail. There are times when some patients cannot find relief from conservative measures or medications alone. Initially, if you are not experiencing relief of symptoms, your doctor may try to increase the dose of medication you are taking, or by switching you to a different one. Failing this, some patients may be candidates for injections of a drug called botulinum toxin or Botox into the bladder muscle. This therapy is being used more and more, although it is not an FDA or Health Canada approved use of this medication. A separate module discusses this medication further. Besides Botox, many patients have found relief through the placement of a so-called bladder pacemaker or nerve stimulation device into the nerves of the lower spine, pelvis, or groin. Finally, as a last resort, some patients may require surgical enlargement of the bladder in the most severe cases. In summary, overactive bladder, or OAB, is a condition of frequent and urgent urination, nighttime urination, and sometimes urine leakage or incontinence. OAB is a common problem, and it can negatively impact a person's quality of life. There is usually no particular reason why a person develops OAB, meaning that there is usually no worrisome underlying problem such as cancer. Successful treatments for overactive bladder do exist. These begin with certain lifestyle changes a person can make, along with behavioral changes and physical therapies. When this is not enough, very effective medications can be prescribed. And failing both of these, surgical treatments are also now available. Your doctor can help guide you along your way to overcoming the bothersome symptoms of overactive bladder. These resources may help you find further information or support about your condition. This slide shows a sample of modern references discussing overactive bladder, available through the internet or at your local medical library, if you wish to do more reading on this subject. We sincerely hope that this module has furthered your understanding of overactive bladder. If you are concerned about symptoms of overactive bladder, please speak with your doctor. Other modules are available through your doctor's office that discuss OAB and its treatment in greater detail.